NHA Medical Assistant Practice Test. Question 1. In anatomy and physiology exam preparation, muscular system appears as a key term. Which meaning is correct? Option A. The organ system made up of skin, hair, nails, and glands. Option B. The brainstem region controlling vital autonomic functions. Option C. The cardiac structure that normally initiates each heartbeat. Option D. The organ system responsible for movement and heat production. The correct answer is option D. The organ system responsible for movement and heat production. Muscular system describes the organ system responsible for movement and heat production. It produces motion, maintains posture, and contributes to temperature control. Integumentary system describes the organ system made up of skin, hair, nails, and glands. Medulla oblongata describes the brainstem region controlling vital autonomic functions. Sinoatrial node describes the cardiac structure that normally initiates each heartbeat. Question 2. Why is explaining the procedure and obtaining cooperation appropriate when the patient appears uncertain about why blood is being drawn? Option A. Prevents dilution or contamination of the specimen by infused fluid. Option B. Reduces anxiety and supports informed participation before needle insertion. Option C. Prioritizes safety and permits prompt positioning and assessment. Option D. Provides a commonly acceptable second-choice site. The correct answer is option B. Reduces anxiety and supports informed participation before needle insertion. Explaining the procedure and obtaining cooperation reduces anxiety and supports informed participation before needle insertion. Not collecting above an active intravenous infusion prevents dilution or contamination of the specimen by infused fluid. Stopping the draw prioritizes safety and permits prompt positioning and assessment, and considering the cephalic vein as an alternative provides a commonly acceptable second-choice site. Question 3. Which outcome supports verifying insurance requirements before scheduling a referral when a health plan may require a primary-care referral? Option A. Improves efficiency by grouping comparable services. Option B. Prevents avoidable access and payment problems. Option C. Reserves enough time for the expected clinical work. Option D. Prevents unsafe crowding and excessive delays. The correct answer is option B. Prevents avoidable access and payment problems. Verifying insurance requirements before scheduling a referral prevents avoidable access and payment problems. Using clustering for similar procedures improves efficiency by grouping comparable services, while matching appointment length to visit type reserves enough time for the expected clinical work. Not double-booking without authorization prevents unsafe crowding and excessive delays. Stressed about your NHA Medical Assistant Exam? We can take NHA Medical Assistant Exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. How should remittance advice be understood when studying billing and coding basics? Option A. A payer check comparing a service with the reported diagnosis. Option B. Code detail identifying right, left, or bilateral involvement. Option C. The payer report explaining payment and adjustment decisions. Option D. The encounter form listing common diagnoses, procedures, and charges. The correct answer is option C. The payer report explaining payment and adjustment decisions. Remittance advice refers to the payer report explaining payment and adjustment decisions and supports posting of payments, denials, and contractual amounts. Medical necessity edit refers to a payer check comparing a service with the reported diagnosis. Laterality refers to code detail identifying right, left, or bilateral involvement, and superbill refers to the encounter form listing common diagnoses, procedures, and charges. Question 5. In CLIA and laboratory quality exam preparation, reagent lot verification appears as a key term. Which meaning is correct? Option A. A record showing storage or testing conditions over time. Option B. A risk-based quality approach permitted for eligible non-wave test systems. Option C. An error occurring after analysis. Option D. The valuation of a new reagent lot before routine patient use. The correct answer is option D. Evaluation of a new reagent lot before routine patient use. Reagent lot verification refers to evaluation of a new reagent lot before routine patient use and confirms acceptable performance compared with expected results. Temperature log refers to a record showing storage or testing conditions over time. Individualized quality control plan refers to a risk-based quality approach permitted for eligible non-wave test systems, and post-analytical error refers to an error occurring after analysis. Question 6. Which safety or quality benefit comes from lowering the examination table before the patient gets off when the visit is complete and the patient is preparing to stand? Option A, maintains potency and prevents temperature-related damage. Option B, reduces the risk of accelerated burning in an oxygen-enriched environment. Option C, reduces unsafe reaching or unassisted attempts to stand. Option D, decreases the height of a potential fall. The correct answer is option D, decreases the height of a potential fall. Lowering the examination table before the patient gets off decreases the height of a potential fall. Storing medications maintains potency and prevents temperature-related damage. Avoiding petroleum products near oxygen equipment reduces the risk of accelerated burning in an oxygen-enriched environment, and placing frequently used items within the patient's reach reduces unsafe reaching or unassisted attempts to stand. Question 7. The assistant plans to ask the patient to remain still and quiet after noting that the tracing shows irregular jagged interference during movement. Which reason supports this step? Option A, provides a practical average rate from a defined time interval. Option B, restores consistent electrical contact. Option C, reduces somatic tremor artifact from skeletal muscle activity. Option D, distinguishes physical electrodes from the electrical views called leads. The correct answer is option C, reduces somatic tremor artifact from skeletal muscle activity. Ask the patient to remain still and quiet. This reduces somatic tremor artifact from skeletal muscle activity. Counting QRS complexes in 6 seconds and multiply by 10 for an estimated rate provides a practical average rate from a defined time interval. Securing loose electrodes and lead wires restores consistent electrical contact, and recognizing that a 12-lead EKG uses 10 electrodes distinguishes physical electrodes from the electrical views called leads. Question 8. After recognizing that a small controllable fire occurs and evacuation is not immediately required, why should the assistant use the pass sequence for a portable fire extinguisher? Option A, standardizes pulling the pin, aiming, squeezing, and sweeping. Option B, reduces unsafe reaching or unassisted attempts to stand. Option C, prevents an unobserved fall from height. Option D, provides product-specific first aid and hazard information. The correct answer is option A, standardizes pulling the pin, aiming, squeezing, and sweeping. Using the pass sequence for a portable fire extinguisher standardizes pulling the pin, aiming, squeezing, and sweeping. Placing frequently used items within the patient's reach reduces unsafe reaching or unassisted attempts to stand, while not leaving a confused patient unattended on an elevated table prevents an unobserved fall from height. Reviewing the safety data sheet for a chemical exposure provides product-specific first aid and hazard information. Are you looking for NHA Medical Assistant Exam actual questions? Visit our website pokerexams.com to access NHA Medical Assistant Exam Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get NHA Medical Assistant Exam answer key today. Question 9. In this situation, fluid soaks through the wrapper of a sterile package. Why is discarding a sterile item that becomes wet appropriate? Option A, provides the required level of reprocessing for semi-critical equipment. Option B, destroys all forms of microbial life including bacterial spores. Option C, avoids strike-through contamination from microorganisms traveling through moisture. Option D, protects mucous membranes of the nose, mouth, and eyes. The correct answer is option C, avoids strike-through contamination from microorganisms traveling through moisture. Discard a sterile item that becomes wet because it avoids strike-through contamination from microorganisms traveling through moisture. Using high-level disinfection for applicable semi-critical devices provides the required level of reprocessing for semi-critical equipment. Sterilizing instruments that enter sterile tissue destroys all forms of microbial life including bacterial spores. And using a mask and eye protection when splashed to the face is possible protects facial mucous membranes. Question 10. Which result is expected from replacing dried or poorly adhering electrodes when an electrode repeatedly lifts from the skin? Option A. Records the right-arm electrical reference without reversing sides. Option B. Restores reliable contact instead of taping over a failed adhesive surface. Option C. Establishes the standard left parasternal chest-lead location. Option D. Provides a reliable landmark for counting ribs and spaces. The correct answer is option B. Restores reliable contact instead of taping over a failed adhesive surface. Replace dried or poorly adhering electrodes. This restores reliable contact instead of taping over a failed adhesive surface. Placing the right-arm electrode on the right upper limb area records the right-arm electrical reference without reversing sides, while placing V2 at the fourth intercostal space at the left sternal border establishes the standard left parasternal chest-lead location. Locating the fourth intercostal space from the sternal angle provides a reliable landmark for counting ribs and spaces. Question 11. When a patient asks whether symptoms prove a specific disease, why should the assistant not independently diagnose a patient? Option A. Reserves diagnostic conclusions for licensed providers. Option B. Verifies the act of signing while keeping disclosure duties with the provider. Option C. Refers interpretation to an authorized clinician. Option D. Communicates the provider's decision without independently prescribing. The correct answer is option A. Reserves diagnostic conclusions for licensed providers. Do not independently diagnose a patient. It reserves diagnostic conclusions for licensed providers. Witnessing a consent signature without providing the provider's explanation verifies the act of signing while keeping disclosure duties with the provider. Not independently interpreting an EKG refers interpretation to an authorized clinician, and transmitting an authorized prescription refill communicates the provider's decision without independently prescribing. Question 12. Why is avoiding routine hydrogen peroxide unless specifically ordered appropriate when the patient asks to pour peroxide into a healing wound? Option A. Prevents unnecessary damage to viable tissue. Option B. Avoids dragging organisms into cleaner tissue. Option C. Improves the chance of recovering the responsible organism. Option D. Supports continuity by recording measurements, drainage, materials, and response. The correct answer is option A. Prevents unnecessary damage to viable tissue. Avoiding routine hydrogen peroxide unless specifically ordered prevents unnecessary damage to viable tissue. Cleaning from the least contaminated area toward the most contaminated area avoids dragging organisms into cleaner tissue, while collecting a wound culture before starting antibiotics when ordered and feasible improves the chance of recovering the responsible organism. Documenting the wound, care performed, and patient tolerance supports continuity by recording measurements, drainage, materials, and response. Question 13. Which outcome supports cleaning and disinfect shared equipment between patients when a pulse oximeter has just been used on a patient? Option A. Prevents contaminated equipment from transmitting organisms. Option B. Creates a barrier against contamination of the hands. Option C. Prevents indirect contamination of items intended for patient care. Option D. Minimizes handling and reduces needle stick risk. The correct answer is option A. Prevents contaminated equipment from transmitting organisms. Cleaning and disinfect shared equipment between patients prevents contaminated equipment from transmitting organisms. Donning gloves when contact with blood or body fluids is anticipated creates a barrier against contamination of the hands, while separating clean supplies from contaminated materials prevents indirect contamination of items intended for patient care. Placing used needles directly into a sharps container minimizes handling and reduces needle stick risk. Question 14. What is the main reason to track specimen source and collection time when more than one tissue sample is obtained? Option A. Prevents wrong-patient, wrong-procedure, and wrong-site events. Option B, prevents site confusion and supports accurate pathology correlation. Option C, preserves awareness of hand position and reduces contamination. Option D, maintains sterility while replenishing the field. The correct answer is option B, prevents site confusion and supports accurate pathology correlation. Tracking specimen source and collection time prevents site confusion and supports accurate pathology correlation. Confirming the correct patient, procedure, and site during a time-out prevents wrong-patient, wrong-procedure, and wrong-site events. Keeping hands above waist and in view when scrubbed preserves awareness of hand position and reduces contamination, and adding sterile supplies without touching non-sterile surfaces maintains sterility while replenishing the field. Question 15. How does documenting equipment inspections and maintenance help when a medical device receives scheduled service? Option A, ensures older usable supplies are consumed before newer stock. Option B, makes information retrievable and prevents misclassification. Option C, supports timely review and correct filing. Option D, provides evidence of safety and compliance. The correct answer is option D, provides evidence of safety and compliance. Documenting equipment inspections and maintenance provides evidence of safety and compliance. Rotating stock by expiration date ensures older usable supplies are consumed before newer stock. Indexing scanned documents to the correct chart section makes information retrievable and prevents misclassification. And date-stamping supports timely review and correct filing. Question 16. Which safety or quality benefit comes from escalating repeated no-shows according to policy when a patient has missed several important follow-ups? Option A, supports risk management and appropriate outreach. Option B, ensures the patient receives complete preparation information. Option C, reduces no-shows while respecting communication preferences. Option D, preserves access for problems needing prompt evaluation. The correct answer is option A, supports risk management and appropriate outreach. Escalate repeated no-shows according to policy because it supports risk management and appropriate outreach. Recording scheduling instructions accurately ensures the patient receives complete preparation information, while confirming appointments using the patient's permitted contact method reduces no-shows while respecting communication preferences. Reserving urgent slots when the practice uses them preserves access for problems needing prompt evaluation. Question 17. The assistant plans to witness a consent signature without providing the provider's explanation after noting that the provider has completed the informed consent discussion. Which reason supports this step? Option A, demonstrates ongoing competence and compliance. Option B, verifies the act of signing while keeping disclosure duties with the provider. Option C, supports access without replacing the provider's clinical evaluation. Option D, escalates information rather than making a diagnosis. The correct answer is option B, verifies the act of signing while keeping disclosure duties with the provider. Witness a consent signature without providing the provider's explanation. This verifies the act of signing while keeping disclosure duties with the provider. Maintaining required credentials and continuing education demonstrates ongoing competence and compliance. Setting up telehealth technology supports access without replacing the provider's clinical evaluation. And reporting abnormal findings promptly escalates information rather than making a diagnosis. Question 18. After recognizing that a visual colorimetric test is ready to be read, why should the assistant compare test colors under adequate lighting? Option A, improves accurate comparison with the manufacturer's chart. Option B, prevents false interpretation from reading too early or too late. Option C, identifies unilateral deficits that binocular testing may conceal. Option D, documents that required storage conditions were maintained. The correct answer is option A, improves accurate comparison with the manufacturer's chart. Compare test colors under adequate lighting. It improves accurate comparison with the manufacturer's chart. Following the exact timing specified by the test procedure prevents false interpretation from reading too early or too late. Testing each eye separately during visual acuity screening identifies unilateral deficits that binocular testing may conceal, and maintaining reagent and equipment temperature logs documents that required storage conditions were maintained. Stressed about your NHA Medical Assistant Exam? We can take NHA Medical Assistant Exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. In this situation, an unresponsive adult is not breathing normally and has no pulse. Why is beginning high-quality chest compressions when no pulse is present appropriate? Option A. Addresses bronchospasm while determining whether emergency escalation is needed. Option B. Stops ongoing heat injury without causing cold damage. Option C. Maintains circulation until advanced care or an AED is available. Option D. Combines emergency activation, compressions, and airway assessment. The correct answer is option C. Maintains circulation until advanced care or an AED is available. Begin high-quality chest compressions when no pulse is present because it maintains circulation until advanced care or an AED is available. Assisting with a prescribed rescue inhaler addresses bronchospasm while determining whether emergency escalation is needed, while cooling a minor thermal burn with cool running water stops ongoing heat injury without causing cold damage. Beginning CPR if a choking patient becomes unresponsive combines emergency activation, compressions, and airway assessment. Question 20. Which result is expected from notifying the provider promptly of concerning symptoms or tracing changes when the patient develops chest pressure during the EKG? Option A. Reduces somatic tremor artifact from skeletal muscle activity. Option B. Prevents recording the wrong patient or an unrequested procedure. Option C. Prioritizes clinical assessment rather than independent interpretation. Option D. Reduces tremor and improves tracing quality. The correct answer is option C. Prioritizes clinical assessment rather than independent interpretation. Notifying the provider promptly of concerning symptoms or tracing changes prioritizes clinical assessment rather than independent interpretation. Asking the patient to remain still and quiet reduces somatic tremor artifact from skeletal muscle activity. Verifying the patient and the EKG order prevents recording the wrong patient or an unrequested procedure, and warming a shivering patient when possible reduces tremor and improves tracing quality. Question 21. When a patient needs to schedule complex specialty care, why should the assistant arrange a qualified interpreter for coordinated services? Option A. Improves accurate communication across settings. Option B. Creates a traceable record of actions, barriers, and resolution. Option C. Organizes situation, background, assessment data, and recommendation. Option D. Keeps the team and patient aligned with the current plan. The correct answer is option A. Improves accurate communication across settings. Arrange a qualified interpreter for coordinated services. It improves accurate communication across settings. Documenting every coordination contact and outcome creates a traceable record of actions, barriers, and resolution. Using a structured handoff such as SPAR organizes situation, background, assessment data, and recommendation, and updating the care plan after new information is received keeps the team and patient aligned with the current plan. Question 22. Which description from anatomy and physiology corresponds to medulla oblongata? Option A. Maintenance of a relatively stable internal environment. Option B. The microscopic air sacs at the ends of bronchioles. Option C. The brainstem region controlling vital autonomic functions. Option D. The selectively permeable boundary surrounding a cell. The correct answer is option C. The brainstem region controlling vital autonomic functions. Medulla oblongata refers to the brainstem region controlling vital autonomic functions and regulates breathing, heart rate, and blood vessel tone. Homeostasis refers to maintenance of a relatively stable internal environment. Alveoli refers to the microscopic air sacs at the ends of bronchioles, and cell membrane refers to the selectively permeable boundary surrounding a cell. Question 23. Which outcome supports inserting an intradermal needle at a shallow 5- to 15- degree angle when a tuberculosis skin test is being administered? Option A. Prevents a common cause of needle stick injury. Option B. Places the bevel just beneath the epidermis. Option C, supports rapid response to a rare severe allergic reaction. Option D, improves antisepsis and reduces stinging from wet alcohol. The correct answer is option B, places the bevel just beneath the epidermis. Insert an intradermal needle at a shallow 5- to 15- degree angle. It places the bevel just beneath the epidermis. Not recapping a used injection needle prevents a common cause of needle stick injury. Keeping emergency supplies available during vaccination supports rapid response to a rare severe allergic reaction, and cleaning the site improves antisepsis and reduces stinging from wet alcohol. Question 24. What is the main reason to monitor incomplete charts and signatures when documentation remains unfinished after the visit? Option A, communicates clearly using approved format, tone, and signature authority. Option B, supports charge capture without adding unsupported services. Option C, promotes fairness while allowing authorized escalation when needed. Option D, supports timely record completion and billing accuracy. The correct answer is option D, supports timely record completion and billing accuracy. Monitor incomplete charts and signatures. It supports timely record completion and billing accuracy. Using professional business correspondence communicates clearly using approved format, tone, and signature authority. Preparing encounter forms or superbills accurately supports charge capture without adding unsupported services, and following written office policies consistently promotes fairness while allowing authorized escalation when needed. Question 25. A record related to HIPAA privacy and security includes electronic protected health information. Which interpretation is appropriate? Option A, an impermissible use or disclosure that compromises privacy or security. Option B, technology protecting electronic information and controlling access. Option C, a specific written permission for a use or disclosure not otherwise permitted. Option D, protected health information maintained or transmitted electronically. The correct answer is option D, protected health information maintained or transmitted electronically. Electronic protected health information means protected health information maintained or transmitted electronically. It is subject to security rule safeguards in addition to privacy protections. Breach means an impermissible use or disclosure that compromises privacy or security. Technical safeguard means technology protecting electronic information and controlling access. Authorization means a specific written permission for a use or disclosure not otherwise permitted.